Hey guys, so it's day 2 post-op from my L4-L5 total disc replacement surgery. The surgery itself went well, um, but I did wake up with a complete paralysis of my legs bilaterally. The surgeons and anesthesiologists had only ever seen one case like this before in a man on just one leg. So they had two suspicions. One that it could have been caused by the distraction where they open up the disc space between the L4, L5 when they do the discectomy, and then to raise it up to insert the trial disc to figure out which size disc they need to put in, and then when they put the disc in, and then they cut grooves because it's a pro disc. So they cut grooves into the vertebrae above and below. So they have to open up that disc space much more than it has been because the disc was nearly flat and herniated. So then there was another thing that could have caused it, that's what they're leaning towards. And just a second, I'll get the name. So that medication is called Exparel. So what they do is after they're done with the surgery, before they close up, they use the Exparel. It's bupivacaine, and they numb up your abdomen and then inject around your spine as well to help with pain management post-op. And that lasts for 48 to 72 hours roughly. So with this previous patient, what they think happened is it like compartmentalized around a nerve and numbed up his leg. Mine knocked out both of my legs, so the suspicion is that it ended up acting like a spinal block and has just took away all sensation and movement from my legs. So for me, I woke up paralyzed, completely unable to move or feel either of my legs. But it is slowly starting to come back. Yesterday I was able to stand with physical therapy. I was holding probably 70% of my weight in my arms, like on the walker, and so my back brace on. I have a gait belt over top of that for them to hold on to help me stand and sit back down. I can't feel my feet touching the floor, which is really trippy, and like can't really move them appropriately. So it's the first 2 times all I did was stand. The second or the third time then is when occupational therapy came in right after, and I had to go to, which is always a good thing after surgery. So we did a standing pivot right next to my bed to a commode, and so we know that function's working. I do still have a Foley catheter in, so I haven't peed voluntarily, but like when you're sitting, there's a balloon inside your bladder with that, and so I could feel the pressure of the balloon there that gives you the sensation of needing to pee. So I do think that I have bladder function sensation, which is good, and so we're going to work on getting that fully out today. Other things going on have usually been pain management. I've been in a lot of severe pain, but they've been very good about setting up a pain management routine so that we're staying on top of it and planning it around procedures and physical therapy and things like that. So right now we don't have a when I'm gonna go home date. I was only supposed to stay overnight, and then we had this happen, and initially it was very upsetting because it's something that they hadn't seen before until they called in a colleague who had a patient with it. So it's been really stressful because it's such a rare thing to happen that like I felt like I wasn't being believed at first, and then when they were like essentially stabbing my feet and stuff and getting no reaction, and I couldn't see what they were doing because it was like behind the blankets and stuff, that's when they were like, okay, yeah, something's definitely wrong. So My other things, like my throat's not as sore as it has been just from the ET tube and from the lengthier surgery. So, done things like honey and hot tea and trying to do things that are like non-pharmaceutical as much as possible. Same for pain, trying to do lots of non-pharmaceutical things like moving around as much as possible. It's hard when you can't twist. Last night I tried sleeping on my side a couple times. Didn't get much sleep, was woken up a lot because, of course, in the hospital that's kind of how things go. But I was able to kind of get propped up on one side with the pillow between my knees and stuff, so that helped a little bit to rotate sides a couple times, and then back to laying on my back again and trying to sit up as much as possible. And with the little bit of movement I have gained back with my legs, I'm trying to make sure to move those a lot. I have tattoos on and SCDs, which I guess I can show later. Those things both are DVT prophylaxis to prevent you from ending up with a deep vein thrombosis in your lower extremities. And also Lovenox that is DVT prophylaxis as well. It's I consider it a mild blood thinner compared to long-term larger blood thinners for breaking up clots. This is to prevent the clots in the dosing that it is.